Hi, I'm Lisa Jones, obstetrician gynecologist and CEO at Health First. So you've had your baby, you've come home from the hospital. What's next? You may feel confused or overwhelmed by having an infant in the home. But there are resources available to you, and there are things that your provider will offer to you during this postpartum time. Many practices will now call you roughly 2 weeks after the baby is born to see how you're doing and how you're handling the adjustment to parenthood. They may do a depression screen, looking to identify patients who are at higher risk for postpartum depression, an incredibly common problem that affects roughly 1 in 8 new parents. Postpartum depression is not something to be embarrassed about, but it is something to talk to your provider about. Postpartum depression can be easily treated and shouldn't be something that you hide or choose not to share with your provider. Your provider will also want to see you back at 6 weeks. During that visit, we'll make sure that you have recovered from delivery. We might ask whether you're breast or bottle feeding, what you're planning for birth control, how you're feeling in general, and whether there's any lingering concerns or discomfort from labor and delivery. This is an important appointment. It's an opportunity to land on your birth control method for the next year or two. It's an opportunity to check to make sure any diseases that might have developed during pregnancy have resolved. Gestational hypertension or high blood pressure when you're pregnant and gestational diabetes or diabetes when you're pregnant can both resolve, go away by 6 weeks. And so we want to check to make sure those things are gone. You'll also be seeing your baby's doctor an awful lot in the first months after delivery. These are also opportunities for you to ask your questions. If you're not sure why your baby is acting a certain way or if something is normal, take the opportunity to ask your pediatrician. Take the opportunity to ask your pediatrician about appropriate vaccines for your child. There are an awful lot of vaccines early in life, but all of those vaccines are proven safe and decrease your infant's chances of developing a significant infection. It's important that you know that you can control subsequent pregnancies. We ask that moms wait roughly 2 years between pregnancies. That's the healthiest time when your body has had time to recover and replenish. So thinking about how you'll prevent pregnancies for 2 years is important for your health and for subsequent pregnancies. So you'll want to talk to your provider about that as well. Having a baby is a new and challenging time, but there's resources available to you. Please take advantage of these appointments and these opportunities to get your needs met. Congratulations.